So, Bismillahirrahmanirrahim. So, today our topic is tonsillitis. Whenever there is a written word is in a medical term, this means it's an inflammation. Tons, tonsil, and then they go for tonsillitis. Whenever there is means inflammation. When there is a tomy, if they written tonsillectomy, when the tomy means surgery. Mind it. Two words. When the is added to a word, it means inflammation. When tomy is there, laparotomy, nephrotomy, whatever tomy means, it's a surgical operation has to be done. Wherever tomy is there, if the tonsillectomy means the tonsils are removed by surgical. Myomectomy means breast has been removed. So they have applied, to mind it there. They have done surgical process whenever you have to know tomy and is means tonsillitis means inflammation of tonsils. You can see the inflamed tonsils. It's the tonsillitis means tonsil if inflamed. You most have students when you're childhood, yeah, when you're adulthood, your tonsils are inflamed. Inflammation of tonsil you can see just because how it happens. When the inflamed means it is a tonsillitis. Now, what is a tonsillitis? Tonsillitis is inflammation or infection of the tonsil is medically termed as whether it is infection by antibacterial or antiviral or other reason, or it is inflammation, then it is known as tonsillitis. Tonsils are protective lymph glands that are situated on both sides of the throat. Tonsils constitute an important part of the body's immune system and are vital defense organs. What they do? They protect the body from bacteria and viruses by fighting these as soon as they enters the body via the oral or nasal cavity. When they enter through these cavities, they fight against bacteria and virus. You can see the tonsillitis on the right side. There is an inflamed tonsils, so white patches or nodules, tongue, uvula, and swollen tonsils. You can see over there. The minute the uvula is there, then swelling tonsil you can see over there. But anatomy, you know about the anatomy of the tonsils is that in the normal state, tonsils are pink in color and about the same size. The tonsils, along with adenoids, are said to form the first line of defense against infective organisms. Pathology: when the tonsils get inflamed, they become red, swollen, and may develop pus pockets that start exuding a discharge. In cases with recurrent infections, the tonsils may become so swollen over a period of time so as to almost touch each other. Tonsillitis is very common amongst children. No particular gender predilection is seen in cases of tonsillitis. And don't differentiate between the gender, male or female. Everyone has to have the tonsillitis. You can see normal tonsil and you can see a inflamed tonsil. Uvula is thin and the tonsil is inflamed. In the left side, a soft palate is there, and tonsil is not they have not increased in size. On the right side, after inflammation, they have to be increased in size. Causes, what are the causes? Etiology of the tonsillitis. There can be bacterial and viral infections. They cause tonsillitis through droplet infection. A common cause is Streptococcus bacteria. Other common causes include the adenoviruses, influenza viruses, Epstein-Barr viruses, EBV, parainfluenza viruses, enteroviruses, herpes simplex virus, they may cause the tonsillitis. You can see in these two shapes, one's left side bacterial tonsillitis and right side viral tonsillitis. Right side, red swollen tonsils, throat redness you can see over there, and bacterial there's swollen uvula, whitish spots you can see over there, red swollen tonsils over there, throat redness you can see over there, gray, furry, tongue can be seen in case of there is a bacterial tonsillitis. Triggering factors, how to be produced, how to be in fact, with the foods with artificial colors and preservatives, peanuts, cold foods, cold drinks, ice creams, when they change of weather, extremely cold climate, temp weather, exposure to a lot of pollution, you can have then this tonsillitis. When you take sour fruits, lemon, pineapple, grape, and sometimes orange, so you may have tonsillitis. Sign, you, you can see red and swollen tonsils, white spots, specks or patches on the tonsils, enlarged lymph nodes in neck region, bad and foul breath can be smelled, chances of cough and running nose. Symptoms further, soreness of throat, difficulty in swallowing or painful swallowing of food and drinks, pain or discomfort while swallowing saliva, chances of change of voice, pain in the ears due to common nerve supply of the back, throat and ears, headache, melasy, tiredness, difficulty in taking feeds in babies. This may be the sole indicator in some cases of tonsillitis in infants. Lateral tonsillitis is the type of tonsillitis when tonsils are inflamed as part of the generalized infection of the oropharyngeal mucosa. It's called lateral tonsillitis. You can see in this picture the lateral tonsillitis. Then there is a membranous tonsillitis. Sometimes exudation from crypts mucolases to form a membrane over the surface of tonsil, giving rise to clinical picture of membranous tonsillitis. Then the parenchymatous tonsillitis, when the whole tonsil is uniformly congested and swollen, it is called acute parenchymatous tonsillitis. You can see in this picture over there. How to diagnose? Examination of the throat in tonsillitis, you can find redness and swelling of tonsils. There are defined pus pockets on the tonsils, discharge from the tonsils, you can have seen. In case of tonsillar abscess, pretonsillar abscess, there may be shift of the involved tonsil towards center of the throat. The uvula may be shifted towards the opposite side. It's away from the affected tonsil, so you can diagnose. Further, how to diagnose? Throat swab has to be used. We used to get a sample of the secretion from the back of the throat. Monospot test, a blood test can detect certain antibodies which can help confirm that a person's symptoms are due to mononucleosis. Epstein-Barr virus antibodies. If a monospot test is negative, Antibodies in the blood against EBV might help diagnosis mononucleus. Blood test. This primarily includes a complete blood count, which is done to confirm the presence of any infections. Now, what's the complication of tonsillitis? Severe swelling with spread of infection and inflammation to the end hypopharynx, larynx may occasionally produce increasing respiratory obstruction, although it is very rare in uncomplicated acute tonsillitis. It's mostly swelling problem can be reported when there is a tonsillitis. Further, peritonsillar abscess is one of the complications of acute tonsillitis, and its development means that infection has spread outside tonsillar capsule. Now, spread of infection from tonsil are more usually from a peritonsillar abscesses through the superior constrictor muscles of the pharynx, first result in cellulitis of the neck and later in parapharyngeal space abscess. You can see on the both sides are well swollen. The systemic or general complication of acute tonsillitis are rare and almost confined to childhood. Chance of septicemia. Untreated acute tonsillitis can result in septicemia with septic abscesses, septic arthritis, and leads to meningitis also. Now, treatment is that which are related to pharmacists when they found a patient of tonsillitis, what they do, they give acetaminophen means paracetamol, ibuprofen as analgesic, relieve the symptoms. Then they can add antibiotics are prescribed once bacterial infection is confirmed. When there is a bacterial infection, you can add different type of antibiotics. Then they go for tonsillectomy. Whenever I told you, tomy means removal of that organ. The tonsillectomy for those children who do not respond to antibiotics, quincy, it is usually treated by draining the abscess and antibiotics. Sometimes removing the tonsil is needed to treat that one is quincy. Further, you can see for streptococcal tonsillitis is a 10 to 14 days course of penicillin V, amoxicillin plus beta-lactamase inhibitors, that is clavulanic acid. Further, they go for macrolides or oral cephalosporin can be used in patients. If they are allergic to penicillin, they switch over to macrolides. Analgesic for pain relief, antipyretic if the temperatures to reduce fever, diclofenac, ibuprofens, and they have to be advised to bed rest, hydration, and they have to maintain the oral hygiene. Prevention to avoid, I mostly advise to the young students are that what we have to prevent the sore throat. For prevention, what they have to do, avoid close contact with others who are at risk of tonsillitis. Keep children away from kids who are known to have tonsillitis or a sore throat. Remind kids about the importance of proper hand washing, especially when around people who appear to be sick. Wash and disinfect surfaces and toys. Teaching kids to cover their mouth when coughing or sneezing, preferably using a tissue so that germs do not get on their hands, and show them how to use tissue to wipe their noses. Carry disposable wipes and a hand sanitizer to clean hands.